Dear professors and colleagues, I'm honored to share with you this challenging case of a pigmented lesion of the cheek. Our patient, an 80-year-old with a history of chronic sun exposure, presented with multiple skin lesions. 3 lesions on the left cheek caught our attention. The first appeared as a pigmented macule, the second as a bluish plaque, and the third as an erythematous nodule. The first lesion is a heterogeneous pigmented macule. Dermoscopy reveals an irregular rhomboidal pattern with an invasion of pilosebaceous follicles, all suggestive of a Dubreuil melanoma. The second lesion is an erythematous nodule with a pearly appearance. Dermoscopy shows arborizing vessels as well as ovoidness, all in favor of basal cell carcinoma. As for the third lesion, it is a bluish pigmented plaque, well defined with a pearly border in places, ulcerated in the center. On dermoscopy, we suspected an eccentric pigmented streak-like structures which could indicate a vertical phase SSM melanoma. The dermoscopy also shows possible ovoidness, suggestive of a nodular BCC. Yellow crusts and white circles were also found, suggestive of a pigmented squamous cell carcinoma. The patient therefore underwent a biopsy of all 3 lesions. Histological examination confirmed the suspected diagnosis of a nodular basal cell carcinoma and Dubreuil melanoma. As for the third lesion, what was the correct diagnosis in your opinion? Well, it was neither a BCC nor a melanoma. To our surprise, the histology found a cutaneous tissue with dermal tumoral proliferation connected to the epidermis, arranged in masses. The tumor cells have an abundant clear or eosinophilic cytoplasm with marked atypia, with sparse melanophages, all leading to suspecting adnexal neoplasm. Immunohistochemistry ultimately unveiled the unexpected diagnosis of sebaceous carcinoma. Treatment involved surgical excision with wide margins for all 3 lesions, accompanied by skin flap coverage. First, what is sebaceous carcinoma? It is a rare aggressive form of skin cancer originating from the sebaceous gland, typically occurring in sun-exposed areas like the eyelids. Pigmented variants can present unique diagnosis challenges due to their resemblance to other pigmented lesions, such as basal cell carcinoma and melanoma. There is only one series in the literature aiming to investigate the dermoscopic features and differential diagnosis of extraocular sebaceous carcinoma while comparing each feature with other skin tumors. They collected 15 histologically confirmed sebaceous carcinoma. However, all the lesions were erythematous. When it comes to dermoscopic signs, sebaceous carcinoma showed a higher prevalence of purplish globules. Moreover, the analysis revealed that whitish pink areas, white structureless areas, and yellowish structures were significantly more common among sebaceous carcinoma compared to other tumors. However, none of the studied studied lesions were similar to our patient. Chongyu have also published a case of a pigmented sebaceous carcinoma in an 80-year-old man with chronic sun exposure who presented with a single crusted pearly pigmented nodule of the cheek. Dermoscopy reveals blue-gray blotches, blue-gray dots, a white structureless area, shiny white structures, and ulceration and crusts. Histopathology reveals multiple basophilic tumor lobules. Together with focal squamous spurs and comedonecrosis, the pigment was present in the cytoplasm of tumor cells, melanocytes, and melanophages in the surrounding stroma. As we can see in these images, the pigment was more visible than in our patient. Compared to our case, the dermoscopy shows indeed whitish pink areas and white structureless areas, ulceration and crusts. However, as well as shiny white structures, which is described in Chongyu's study. However, we didn't find purplish globules. Instead, the pigmented structures in our patients were similar to ovoid nests and blue-gray blotches, which could be a new non-reported structure in this skin neoplasm. In conclusion, our case sheds light on the differences in dermoscopy that allow a better differentiation between pigmented sebaceous carcinoma and other pigmented skin neoplasms, since yellowish structures are often absent or masked by purplish globules and blue-gray blotches. However, new unreported dermoscopic findings, such as the ovoid nest-like structures, can be noted. Thus, more cases of pigmented sebaceous carcinoma are needed for better dermoscopic characterization. Thank you.